Why should we worry about all this dry eye, digital strain? What are
Yeah.
the complications?
It's so the complications of dry eye at a younger age group is first of all the incidence of myopia,
Mm. Myopia is you cannot.
nearsightedness. So basically, what's happening is the incidence of myopia has, I mean, the studies have revealed that by 2050, half the population of the world will be myopic.
Wow. They can see only nearby. They can't see anything farther behind.
So they will have a huge problem of myopia and it's increasing at a tremendous
What are you
rate.
talking about? One in two people will have myopia by 2050? Oh my God. I am myopic.
I give you an analysis. There are 8.1 million people in the world. A billion.
Billion.
Sorry. There are about 8.1 billion people in the world. Close to 1.1 billion people in the world already have uncorrected refractive error.
Some kind of eye problem.
Some kind of myopic or some
Myopia.
refractive error. That alone is going to increase tremendously because of the screen time that is involved, because of the digital eye strain that we are putting ourselves through, no outdoor activity, and an increase in amount of other attributed factors like blue light, melatonin not being secreted, dopamine being secreted, you're not getting sleep enough, cognitive function going away. All of these will add up.
So, so the factors that you're talking about, I'm looking from my
Yes,
actually a
yes, yeah,
selfish
yeah,
reason
absolutely.
where I am seeing my kids, and it's a very common thing to have screen time for the kids. Uh, Based on what you're discussing, I'm thinking along the same scenario where my son is looking at the screen, not at like a one arm distance or anything like that, right? So he's training his
Training his
eyes.
eyes.
The longer, then evaporates and dry eye and all this comes in.
Correct. The eye muscles are very involuntary muscles. They're not a voluntary muscle that I can flex and close. I can flex and release. No, I can't do that with the eye. If I put something in front, in order to view involuntary, my eye has to flex. I'm
To
not
focus on that.
choose, yeah, to focus on it. Now what's happening is now it's in perpetual flex mode. Instead, now if I send them or I incentivize my kids to play outside, you have to incentivize. You'll be smart on in this today's world. Please incentivize your kids to play outside. Go and play a sport for 1 hour every day outside, whatever it is, especially in the younger age group. So those are small things that you can do. Incidence, as you asked me, what is dry eye complications? Incidence of myopia is according to be the number one complication of chronic dry eye. Not just dry eye, digital eye strain. I'm adding all
No,
of
of
this
course,
together.
of course.
The second complication of dry eye is infection, as you said earlier.
For that,
One
my
for that
resident.
your resident could be an infection of the eye that was chronic in nature before, from the chronic dry eye he was facing. It's gone into an infectious mode because now the immunity is dropped. There's not enough tear secretion. There's nutritions are not coming in. The toxins are not going out. What's happening? You're creating a state of stagnancy in the eye, and it leads to one little bacteria, one little virus from outside coming in. Adenovirus is known to do this. Causes an infection of the cornea, rush, start drops, if not taken care of pretty well, can lead to even a complete ulceration of the cornea, can lead to transplant of the cornea, vision loss, multitude of sequential events that are happening that are completely now out of your control.
How often you see this in your
Oh,
practice?
corneal, so I'll give you a simple scenario. In the group, we do close to about 1,000 transplants a year. Corneal transplants, 1,200 a year. Pretty much all of them are based out of some dry eye or complication of,
Oh my God.
yeah,
That's 100 a month.
yeah, it's a huge number.
It's a huge.
That's a
And
huge
the
number.
number is increasing?
The
Or
number is increasing, but because of good protective or preventive mechanisms being put into our branches all around, there have been a reduction in severity of them. It doesn't mean the chronic dry eye disease is going away. That is on an increase, but we're able to prevent it from going into transplant mode. We're able to protect the transplantation mode, but it still comes through. I mean, you have those filtering still coming in where you have a lot of patients coming in for dry eye.